In terms of policy, out of the 117 documents that we downloaded, we realized 49 of them did not meet the criteria to give us the information we were looking at. We dropped them. That took us to the third and last step of desk review for policy, financing, and for policy and financing. And in total, the documents that we found were relevant for policy were 56. That is the 47 CIDPs 2023-2027, and 9 national documents in relation to health, education, and social protection. For finance, we finally used 8 finance documents, and that is the county budget implementation reports and the national budget implementation reports. So the information we are going to give in this study will be derived from those documents that we were able to review. In terms of interviews, we went to 7 counties, and each county was representing an economic block. That is Trans Nzoia, Siaya, Nairobi, Kajiado, Garissa, Tharaka Nithi, and Mombasa. So in total, for qualitative, we conducted 124 interviews. 14 of those were focus group discussions, 7 for community health assistants and 7 for community health promoters. The rest were for different departments. I know some of you might have participated in this, and civil society organization. So, what were the findings in terms of policy? And I mentioned that in terms of policy, we were measuring how policy documents are responding to the nurturing care components or subcomponents, and looking at the APOA study that was conducted in 2022, they tried to unpack the various components and the subcomponents that form them. For example, good health has 13 subcomponents. Adequate nutrition has 9 subcomponents. Responsive caregiving has 9 subcomponents. Safety and security, 10 subcomponents. And early learning opportunities, 7 subcomponents. So whatever information I'm going now to give, the findings will be revolved on those subcomponents that we were looking at. So the first indicator you remember I mentioned was the degree to which existing national level sectoral policies cover components of nurturing care. And in this, we reviewed 9 documents that were developed or reviewed between 2020 and 2024. And they included, under education, the Early Childhood Education Act 2021. For health, we reviewed 2, that is the Kenya Community Health Policy 2020, and the Newborn and Child Health Strategic Plan 2022. For social protection, we looked at the Kenya National Care Policy 2024 and the National Positive Parenting Program Guidelines. And there were documents that we found were multi-sectoral in nature, that they were cutting across, including the fourth Medium Plan 2023-2027. We also looked at the draft Integrated Early Childhood Development Policy 2024, the Children's Act 2022, and we also looked at the report, the Demographic Health Survey Report 2022, because it speaks to indicators that affect children's health and all the other indicators. So our findings were that out of the 9 documents that we reviewed, 7 of them make reference to good health, 8 make reference to adequate nutrition, and 7 make reference to responsive caregiving. However, when you look at those policy documents, you realize early learning opportunities only appear in 3 of them, and safety and security happens in 4 of those documents. In terms of the degree to which existing county sectoral policies cover the nurturing care components, we realized that early learning opportunities, adequate nutrition, good health is covered in almost all the CIDPs for the 47 counties. But looking at responsive caregiving and safety and security, the county integrated development plans do not make a lot of reference to it. We went further to look at the subcomponents, the 48 subcomponents that we mentioned there, the 13, the 9, 7, 10, and all that. We tried to check how are these subcomponents taken care of in the various documents. Looking at health, good health, we noted that things like kangaroo care for low-weight babies, preterm prevention, and care for newborn receive much less attention. And then early detection of disabilities is also underrepresented in those documents. In terms of adequate nutrition, we noted that malnutrition management, micronutrients, and deworming, most CIDPs are mentioning about them. They have a plan for the same. But feeding children during illness was underrepresented in terms of having a plan and the finances for the same. Support for maternal nutrition and complementary feeding is present in slightly over half, but many CIDPs still lack clear budgets for implementation on how it should happen. When it comes to responsive caregiving, we noted that generally, this is an area that has been neglected. Only 38% of the CIDPs make mention to that and have a plan for childcare facilities. We also noted that involving fathers and extended families was only referenced and had a plan in only one county, and that is Moranga County, which has a plan on a program they call Father-to-Father Support Group. All the other 46 counties did not have that, and we feel that is a big gap that needs to be addressed. In terms of early learning opportunities, we noted that, of course, early childhood education is a devolved function and it received a lot of attention. But when we went to the 7 subcomponents that we mentioned, we realized things like book sharing, storytelling, mobile toy libraries, use of local language, play groups for caregivers, and the like, they are not given attention. And one thing we are realizing, if something is missing from the 5-year plan, it's likely not to appear in the annual development plan. And I know from our dissemination, we learned that there is an annual work plan which might be having a lot of this, but since they are not publicly available documents, we were not able to get access to them. So we are reporting from information that we got from the public resources. In terms of safety and security, nearly half, that is 40%, counties have a plan to ensure safe water, sanitation, and hygiene, while the rest do not have. Birth registration is an area that is not really taken care of in most CIDPs. And then supporting family to foster care over institutional care is largely absent in terms of planning. So then we looked at the 48 indicators, and we were trying to see from the 7 counties where we went, how is implementation? From the 14 counties, I think the person who is projecting is lagging behind. So from what? The 14, that's not where I am, I've gone ahead. So the 14 out of the 7 counties and out of the 48 subcomponents of nurturing care, we noted that Nairobi County and Siaya County were implementing 16 out of 48, Kajiado 15, Mombasa 14, Tharaka Nithi 13, Trans Nzoia 11, and Garissa 9. If this is what we are looking at in terms of implementing the nurturing care framework, and those are the components that we can be implementing, you can see we have a long way to go for us to be able to implement. Benta, when she was presenting, she did indicate that we used the Saber rubrics to assess where are we in terms of implementing the policy. And she mentioned 4 rubrics. That is latent, which means the county or the country, for her it is the country, the 3 countries, but for us the county is at least implementing 50% coverage of one or fewer components of nurturing care, so 1 out of 5. So if that is what we are implementing, then that county is at latent, the lowest level. If it is implementing at least 50% of 2 or more components, then that is the county that is emerging. And then if the county is established, then it means that county is implementing at least 50% coverage of 3 or more components of nurturing care, with more than 1/4 of the mentioned subcomponents having an associated plan or a budget. And then the aspiration is to be at the advanced level. So for us to be at the advanced level, then it means that county or country is implementing at least 50% coverage of all the 5 components, with more than half of the mentioned subcomponents having an associated plan. So using these rubrics, where do we find the 7 counties that we went to, because that's what we were looking at. When we look at the national level, at least we have three components. That is good health, responsive caregiving, adequate nutrition, over 50. So that places our country at established. And that's the finding that Benta gave us. When we look at the counties, at the 7 counties that we did, we did an average, and we looked and we saw that good health, adequate nutrition, early learning opportunities were at 100%, and that gives us to be in established, because at least we have 3 or more components that are being implemented. So what are some of the conclusions that we are making in relation to policy environment in Kenya? Under good health, nationally, we are saying this is covered in multiple sectors, but not in education. When we look at it from the lens of the county, we noted that all the CIDPs made reference to good health, but things like kangaroo care and preterm birth prevention are underrepresented. In terms of adequate nutrition, nationally, the focus on breastfeeding and micronutrient is happening, but there is less on illness, feeding, and fortification. And at the county level, most CIDPs address adequate nutrition, but feeding during illness is missing. Responsive caregiving, it is poorly integrated nationally, and at the county level, it's also minimally represented. And for early learning opportunities, nationally, it's underrepresented in policies that are speaking to health and social protection, but in policies speaking to education, it is included. And at the county level, it is prominent, and I think because this is a devolved function, but when it comes to book sharing and storytelling, these components, subcomponents are missing. And finally, on safety and security, there is less attention in multi-sectoral and healthy policies, but at the county level, coverage varies and gaps in clean environments exist. So what are we concluding in terms of policy environment? We are saying there is need for an integrated policy framework to ensure that all the nurturing care components are taken care of. We need to have a holistic county integrated development plans that includes plans and budgets for responsive caregiving, child protection, and broader early learning interventions. There is need for strengthened health and nutrition interventions. We need to invest in responsive caregiving, and there is need to have safety and security emphasized to incorporate child protection strategies, and capacity building and advocacy to train policymakers is key, and we need to ensure that we do that. Thank you, and now I want to invite Fred to come and continue, because this is one study that we are presenting. Fred.
Thank you very much, Fred. I think try and manage time. Kindly, you can take about 5 minutes, so that we also give 5 minutes to Dr. Oyagi.
Thank you. Good morning, everyone. I'll be presenting on governance, and I'll try to make it short so that then I can allow Dr. Moses to do the final presentation. The study on governance is what is feeding from the qualitative data that we collected in the 7 counties, and we were looking at 5 indicators that Prof indicated earlier. So my slides are arranged into the 5 indicators, sub-indicators, that is on collaboration between government sectors, collaboration between government sectors and non-government sectors on ECD. And then we have data usage, and we'll have a bit of understanding of the role of CHPs and CHAs. And then we'll do at the last one on level of multi-sectoral coordination at county level between different sectors. So my first slide there that you are seeing is on collaboration between government ECD actors. So how do the government ECD actors, how do the departments of government collaborate? What the findings indicates that we had a multi-sectoral partnership, and most of the referenced actors or departments were health, education, social protection, but oftenly we also saw agriculture, water, gender, and child protection coming in just to help. NGOs also played a key role, but they came in to improve service delivery, and especially in marginalized areas. Coordination, how are the coordinating meeting happenings? They were held quarterly, but also on need basis. And this was for collaboration and for issue resolution. So those are the collaboration partners or departments were coming in to do. On funding, on the collaboration activities, who funds the collaboration activities at the county level and at national level, we had high reliance on external donors, and these include the NGOs that are, and the CSOs that are presented here today, but also we had inconsistent government support. At national level, we had support by the government, but again, not fully. It was supplemented by development partners. On collaboration between non-government and non-government actors, what we see is an established system, and we have the roles that now different actors, this is the non-states and state actors coming in, being established, and their roles are established in MOUs. And again, they meet at least quarterly for this one, but their role that comes in is to supplement human resources and also just bring financial resources, as I mentioned, on the financial support on coordination for government actors. Are there barriers that exist within and challenges that exist within ECD coordination? Yes, there are. The first one that comes in clear is the financial constraint that is inadequate and inconsistent. We also have donor fatigue and policy delays, and this is the ICD that we currently looking forward to. We also have limited stakeholders' involvement. You'll agree with me that not all stakeholders are always involved in our coordination meetings, and it's a challenge that we need to address. And then we have lack of clear coordination framework in some of the counties. On data availability and usage, we agree that data is important in making policies, and we were looking at where do the governments get and where do the CSO get data to make their policies, to make information, to allocate resources. So we had the 5 most referenced data systems, that is the Kenya Health Nutrition Information System. We had the NEMIS, we had the Child Protection System, Electronic County Integrated Management Information System, and the KNBS, the Kenya National Bureau of Statistics. All these, as you will agree with me, all these systems are hosted by different departments, and they collect data for only one child. So then we have a system where now each department has a system that then collects information about a child. Are there challenges that then we see when we have this different system being hosted by different departments? Yes, the challenges that exist with using data for decision making, we had fragmented system, and this will agree with me in the previous slide. They had 5 different systems hosted by 5 different ministries or departments, and we also have, in some cases, outdated information. Lack of integration across sectors and reporting delays was also a challenge that was reported by our respondents, but also having limited accessibility, and technological constraints. Not everyone is able to access this data even if they exist, and they are not able to make accurate and informed decisions when they need. I also have influence of political, socio-economic factors that then influence usage. At political level, we had varying priorities that then influences people to use this system. At socio level, we had cultural resistance, and at in economic angle, we had funding limitation, competing priorities, especially in marginalized areas. Implementation of nurturing care by CHS and CHPs. We know the CHS, the community health assistants and community health promoters, they play a key role in implementing nurturing care framework, and their roles at household level included providing health, education, immunization, family planning, education. They also conduct regular community visits, address broader social issues, including gender-based violence and mental health. They also had at health level, what do they do? And now this CHS, that is the community health assistant, they bridge now between the community and health facilities, but CHPs also promote awareness, referrals, and defaulter tracing on our children, especially in immunization. Are there any successes that we see when these two key parties collaborate? Yes, we have been, the findings indicate an improved vaccination and immunization, increased community awareness, strengthened healthcare access to the community level, and we also have the dialogue days that then brings in the community programs for education. Challenges that exist? Yes, there are challenges that the CHS reported. One being cultural beliefs, financial constraints, resource challenges being part of the challenges that they indicated that they face while they collaborate together. On my last, about the indicators, we had coordination among government-led multi-sectoral coordination to govern ECD. And this is one thing that I want us to be focused on a little. We had a rubric that was developed by Survey World Bank 2011 that then tries to categorize systems, and in this case, our systems at the county level and national level, into 4 stages or 4 groups. The latent, which means there's no government-led coordinating body. So if all the counties represented here, if you don't have a county-led government coordinating body for ECD, then you automatically falls at latent. And then you go to the next stage, which is emerging. Emerging indicates that we have government-led coordinating body exists, but it has a few limitations here. One of the limitations is it meets at least once. It is not child-focused, and then we also does not have any associated government funding and implementation. It does not include key government sectors. On established, which is towards where we want to be, all of us, the system is child-focused, government-led, multi-sectoral coordination exists, and includes at least actors from 2 or more sectors meeting at least twice. At advanced level, we have government-led government, and it's predominantly funded by the government and represents at least 3 or more sectors meeting at least twice annually. Now let us see on the next slide. I think this is my second last. We were on where our counties are, and the 7 counties that we focused on qualitative data collection. At national level coordination, it was advanced, and this is because of the existence of the NCCS that was created by a mandate from the Children's Act 2022 that then oversees all child affairs, including ECD, working alongside different ministries. At county level, we see an established system across, but again, this varies on activity, leadership, focus on children, among other different activities that the counties do. We have a map that then indicates where each county is. I wish you could see that, but we just see 3 of the counties, 2 of the counties established, and then we have 4 of the counties established, that is Mombasa, Nairobi, Siaya, and Trans Nzoia, and then 3 of the counties that we were targeting are emerging, that is Garissa, Tharaka Nithi, and Kajiado. On recommendation, what are then the findings recommending based on the governance? We need a strengthened multi-sectoral coordination. It is there, we acknowledge, but then it needs to be established and well-funded. Improve stakeholders' resource allocation. Yes, develop a clear framework for joint decision-making. We also have increased funding resource allocation that needs to be to advocate for sustained ECD funding. develop a robust ECD data system, centralized data. We saw we had 5 that were referenced by most of the respondents. We need to have a centralized data system, and also need our last recommendation there, enhanced community health worker support, the CHAs and the CHPs. That is my last slide, and thank you.
Good morning, everyone. All protocols observed. I'll quickly walk you through the finance indicators because of time. So Prof has done a good job in giving us the methodology we use, so I may not dwell so much to explain how we got the computation, so I'll go straight to financing. So the first indicator was on budget allocation. So we started with the national budget, that's the Ministry of Education budget. For the first 2 years, we were not able to get a figure, and for the rest of the 2 years, the National Ministry allocated a budget of 1% to early childhood education. Of course, that is expected because ECD is a devolved function. And then we also compared the expenditure. So of the 1% which was allocated for the 2 years, all of it was expended, which is a good thing. The other thing we did was we did an average of the 47 counties for the 4 years. And what we found is that on average, for the 4 years, 34% is what was allocated to the Department of Education. And this was consistent across the 4 years. But when we move on to the expenditure side, what we found is that it's a range, 65% to 72%, meaning that the counties are not doing so well on this because they're not spending all the money. Then we just to give a glimpse of few counties we sampled. These are 7 counties: Mombasa, Tharaka Nithi, Trans Nzoia, Kajiado, Siaya, Nairobi, Garissa. So what we saw, is that there's a lot of fluctuation across the counties. Counties are allocating as minimal as 1% to ECE, and again, some are allocating as 80-90%, but this is not consistent across the 4 years. So, we had a validation workshop, and some of the feedback we got from the stakeholders was that these points beyond what we found, it's links to system level issues to do with late disbursements, supplementary budgets. So of importance, we looked at the expenditure. Again, of the 7 counties we sampled, none of the county was able to expend all the money. So we had some years spending as low as 34%, 85%, just only a few counties, Siaya and Nairobi, and this is just for 1 year where they were able to spend all the budgeted amount. So the second thematic area is on the primary health care. So we also started at the national level, how much was allocated to primary health care as a percentage of the National Ministry of Health budget. Again, it's a range, so the allocation is between 18% to 25%. That's what was allocated, but looking at the expenditure, then again we see expenditure ranges from 42% to 68%. Again, not all of it is being expended. Again, the reason we got from the validation is similar because of, again, the system, how the money is dispersed to the counties. A lot of issues came with that. So again, we also did an average of the 47 counties on the primary health care budget allocation. So it was an average between 11% to 16%, which was the peak. How much of it was expended? Again, looking at it, is an average 72% to 73%. Same thing. Not all of it is expended. A glimpse of few counties, the 7 I did mention. Again, we see a lot of fluctuation across the counties, as low as 2% being allocated to primary health care. Just a few counties that were able to allocate 16%. That is the highest from the 7 counties we sampled. On the expenditure side, we saw a few counties expending all the money, but largely not all of it was being expended. You could see as low as 4%, and in some cases, so the lowest was 4% for the 7 counties we did assemble. So the other thematic area was on social welfare programs. Same format. We started from the national level, and on the budget allocation, it is 9% to 16%. That's the peak that budget was allocated. Whether it's adequate is a question for us to ponder. In terms of expenditure of this 9% to 16%, it ranged between 87% and 101%. So 101% that went over and above that what was in the budget. Again, this was 2020, the time of COVID. That could explain that. But for the rest of the 2 years, we clearly see that not all what was allocated was being spent. We also did an average of the 47 counties. The range is between 20% to 27% budget allocation. Again, the question for all of us is this adequate? But what we're hearing from the validation feedback is that it's not adequate. Of importance for us just to look at this little that is allocated to us. Is it allocated all of it? So what we found also is that on average is from 61% to 64% out of the 20 to 25% which was allocated. So again, meaning that not all of this what was allocated is being spent. So a lot of this money is not being put into use. So then the question is, where does this money go to? So then again, a glimpse of the 7 counties in terms of the social welfare programs budget allocation. Same scenario, fluctuations across the years, fluctuations across the counties. In terms of adequacy, as low as 5%. Highest county allocated 51%. Of course, we had cases where we could not get a clear budget line. That's where you see the zeros. And then on the expenditure, then we again see the same format. Counties are not able to utilize all their money. Just a few cases whereby you found accountants utilize all the budget, or the money that was allocated, but you find it in only 1 year. And then when you move across the rest of the years, again, we go back to not spending all the money. So based on that, we made a few recommendations. So the first is to improve county budget absorptions for ECE, and this will require counties to strengthen their financial planning and expenditure.
Daktari, a bit louder so we can hear those great recommendations.
Okay, sorry. Yeah, so the first recommendation was for counties to improve their account absorption for ECE. So this requires counties to strengthen financial planning and expenditure efficiency to allocate funds and fully utilize them for ECE development. So the second recommendation was to stabilize and increase PHC funding. So, and this goes to both national and county governments. And there's need for them to allocate more, and of course make sure that this is predictable, to ensure that PHC funding is sustainable. And then the last one is on ring fencing, and this is specifically on social welfare programs. And these are called for the counties to earmark, the funds allocated to social welfare programs. And this is to ensure that they're not diverted to other areas. Thank you very much. I rushed through because of them. Thank you.
Great. Thank you so much, our presenters, for those great findings. I think we all need the report so that we are able to see how we review the findings and also how we implement. I'll request, if you don't mind, if you can come here, we take 2 or 3 questions because our time is so much gone. Sally, you're going to help with taking the mic around. And if I start, I can ask, I'll start if you don't mind. Then I give 2 or 3 people questions. From your study, what I wanted to find out, because by the end of the day, what we also want to know is, are our children developmentally on track? From this finding on finance, on data, on governance? Are we able to tell? I mean, I know we have done a DHS, we added ECD index in the DHS, but from what you're finding, and in terms of the blocks that you grouped, are you able to tell us which counties in terms of children being developmentally on track, just from your overview? And then I also would have wanted to hear about, in terms of the budgets, and I know we have experts here on budget, but I wanted to find out, in terms of supplementary budget, that which is allocated and expended. I mean, did we find so much of allocated budget for ECD being impacted by supplementary budget, and then affecting the expenditure? So kindly, let's have questions from delegates. Ladies and gentlemen, we have two questions on this side. Dr. Simiu,
Thank you very much. Maybe I will stand for the respect of the audience. Simiu Robert, UNICEF. Thanks a lot. Two questions. One, expenditure seems quite long. It's one thing to allocate money, it's the other to receive and spend. What are the underlying reasons so that we remove those bottlenecks? And then secondly is methodology. How did you define ECD expenditure within the broader budgets? It would be good to understand that, because within the budget system, you don't necessarily get lines written ECE. So how did you define that? Thanks.
Thank you so much. Mine is a little bit related, but it is on the education budget. For the national government, it could be clear. The directorate of ECD is very clear. But then at the counties level, are we sure the money that goes to education goes to ECD? Because there are bursaries, there are construction works, there are a lot of other popular programs within ECD, within the ministry, within the education department. So did you pinpoint how that is done? The next issue is about the 1% that goes to the national government, which was 100% utilized. I think at the national level, what is important is standardization. We're still seeing the gap between the counties on ECD is widening. There's no standardized way of working together. We might have beautiful policies. What is the intersection to make sure the counties and the national government work together to make sure at least our counties are all at same level? As much as the counties are sovereign governments, but then the standardization and issues to make sure at least we are at the same level is within the mandate of the national government. So how do we at least justify the 1% that was completely utilized has added value to ECD in the counties? Thank you.
Good morning, everybody. This is Professor Simon Onywere from Kenyatta University. 2 or 3 concerns. One, I think we have not made it clear the role of government, the role of non-government organizations, and the role of the private sector. In other words, when you're thinking about the ecosystem of children, there is a responsibility the government is supposed to play, but there are other stakeholders who come in. And the main thing here, if the child is at the center of everything, and the child is at the center of our lives, we seem to be talking about the child as if it is something that is on the side that we want to pull in, when actually the child is us. We began there. We grew from there. So I'm not understanding why we are looking at it. It is something there that we need to pull in and help, when actually we should be fertilizing the child. Okay. The language is, I'm thinking of a plant, a crop. You plant, if you don't nurture that crop, you will not harvest. So we don't nurture the children at the beginning when we bear them. They will not flourish, they will not develop. But whose responsibility it is? The person who bought the child. And then next, there are people who are interested in that child who happens to be the government, because the government wants the good people, the people who are knowledgeable, well-developed, who understand things. So they have to invest there then. After actually the parents have taken the primary responsibility of the livelihood of the child. So I think when we nurture that, then we'll be in. How does the government come in? The government comes in through budgetary allocations, which most of you seem to be saying that there is a government there to give you money to finance ECD in the counties. And you are imagining that the money there is held up and it should come. When actually we ourselves have not purposed to be in the planning stage of financing, the medium-term plans where you go in and really argue your case sector by sector. Children should be in all sectors, and sector by sector we argue our case. So therefore, as they mind the document, I'm not seeing where they are actually pointing us to the institutional arrangements that are there that is able to help us reach those resources. And I think that's where the gap is missing.
Thank you, Prof. Let's write most of our questions and we'll put them together and then they can be answered back to you, Agnes, as I collect more questions. Please write them down. I'm going around collecting them.
Great. Sorry, we apologize because of time. We may not be able to have all the questions, but I think the panelists are here with us. I'll give them now a chance to respond to the questions or some of the comments.
Thank you. The first question, which is on finance. The first question was on expenditure. Of course, he did acknowledge that expenditure is low. And then you want maybe to understand what are some of the reasons. On the face of it, because this was a desk review, it's very quick for, it was quick for us to actually point to inefficiency at the planning. But again, we did our validation workshops. We visited a few counties, just basically to understand the reasons behind this. And what was common across the counties, we held validation workshops that they are attributing this to late disbursements. They get some money from the Treasury, National Treasury, and they are not able to utilize that money. So the other reason was that late disbursement was one reason that was being given. The other one was on the supplementary budget. Also, it was also being attributed to causing this expenditure to be low. Yeah, so those were two key reasons. Of course, yeah, away from planning and inefficiencies. And then the other question was around, are we sure, when it comes to this supplementary budget, did it go to ECE? That was the question, right? Yeah, so no, it wasn't very clear whether the supplementary budget actually was meant for early childhood education. It was just a general explanation we were given. So we are not able to tell whether it went to ECE. There's also a question around national government. The budget allocation was 1%, which I did say that, of course, it's expected being a default function, and all of it was spent for the 4 years we reviewed. So maybe the concern here is to try to see, just to standardize how has it benefited the counties. But basically from maybe what Prof is explaining, we all understand the role of national government. It's more of coordination and policy formulation. So you can allow me to use the term assumption. Our assumption is this money went to that national function. So we may not really be able to link it to the benefits at the county level. Yeah, so maybe my colleagues will also add.
Okay, thank you so much. Number one, our focus was on the systems level. And I clearly stated that the systems we were looking at is policy. How are our policies speaking to those indicators that we have said? That said, and we were looking at the policy in terms of how they have either budget or how they have mentioned or have a plan for implementation of the nurturing care. So, looking at that, we did not go to the next level of trying to understand children's development, because for you to say whether children are developmentally on track, you must assess the development of those children. So our study did not focus on that because we were looking at the systems level. Number two, I want to add to what Moses has said in terms of budget allocation, whether they were affected by the supplementary. Of course, supplementary was cited during dissemination now, because after we collected data, we went to all the 7 counties disseminating the findings for them to validate and help us get reasons why we are seeing budget is allocated, but not all of it is utilized. One of the things that we discovered, when you look at budget allocation, it is not a must that all that was budgeted for will be funded. Sometimes they get less funding, not exactly what they budgeted. So when you are looking at what was budgeted against what was utilized, then you might be giving a wrong impression. But again, as I said earlier, we were looking at the publicly available documents that we utilized. Supplementary also, of course, was cited as another reason, because if funds are delivered late, it means there are activities that were assigned earlier which were not utilized, and because the financial year is coming to an end, the reasons we were given is that sometimes that money can be reallocated. So that also is another reason that was coming out when we were disseminating. In terms of what Dr. Robert asked about the methodology, in terms of how did we define budget lines. For example, in education, the 2 devolved functions, that is pre-primary and vocational and technical training, their budget lines, when you go to the documents, they are clear. Okay, I understand practically, in some of your departments of education, things are lumped like, some they have gender, others they have what. But for us, we were specifically looking for budget lines. If we were looking at budget line allocation against the department, then we were looking at the budget that has been allocated for pre-primary education and vocational training, not the whole budget that goes to that department. And then in expenditure, we look at that budget of pre-primary education, how was it expended? That is an example for education. I hope I'm answering your question, Robert. For where we had challenges is social welfare. Social welfare, unlike education, is not a budget line that you can just go and find this is for social welfare. We were looking for budgets that goes to programs that can support children. In some counties, we could go like, for example, cash transfers. Some counties had child welfare, budget lines speaking to child welfare. Those are the budget lines we were. So there was no consistency, especially in social welfare. For primary health care, as I mentioned, it is huge. So we went for preventive and promotive budget lines. So that is what we looked at. I think, Malim, your question on 1%, I think Moses has answered. Prof. Onywere, he is asking the role of government, NGOs, and private sector on child matters. Again, that takes us to our main purpose of going to the field, looking at the systems level. We didn't go to the nitty-gritties of what private sector is doing. We were looking at what mechanisms have been put in place in terms of engaging or having coordination meetings between the different actors and sectors. Thank you. I hope I've answered the questions.
Yes, you have. 1 minute, Dr.
For
Benta.
me? Okay. Yeah. Thank you, Prof. Thank you, Moses and Fred, for your responses. Colleagues, looking at the insights when they are consolidated at regional level and in response to the whole array of questions, there's great opportunity. This study was informed by tools from varying parties and previous research. Prof, we borrowed heavily from the rubrics of a study that was done by APHRC, and we built on it. we built also on the institutional knowledge of the ECD network. What am I saying? That this study, being a systems level diagnostic and progressing into a baseline and progressing into the next wave of data collection and analysis, presents a great opportunity for us here. So I would like to urge us, as we interrogate the data which is available through the ECD network, to also engage at our levels. What are you as an implementing partner able to gather information more about? The tools are available and can be customized to any level. You're talking about definition of indicators. You can customize additional perspectives. If you're in psychosocial support for children, if you're in food and nutrition, you can customize so that you're able to move it from the policy and systems level to the implementation level. And that's my call to all of us. We need more data. We need more data for budget tracking. We need more data for spending. We need more data for even the dissemination of policy to county level. There's a space for all of us to use this data at our various levels. Thank you.
Thank you. I can see some more questions are coming, but because of time, I would request we don't answer them because we are 1 hour, almost 1 hour ahead. We were supposed to be done by 9:30, so allow us to stop there. And I would request we appreciate again our presenters. As I welcome Sally for the next session.
Asante sana. Makofi kwa Madam Agnes. It is not easy when she has to do the tough job of maintaining that we have the knowledge and maintaining time, and we have walimu wetu ambao wamependa kuongea sana, si ndio? Now, if you look at the program and the time, there's a beautiful lady in yellow walking out. I will give a signal for when we follow her. But this is what I'd like to guide us on kwanza. Najua we are now at the juncture where we were supposed to have our parallel session 1. And first, I'd like to introduce to you, for those ones who will be in breakout room 1 at Swara, there will be Dickens Omedo for you. He'll be your session chair. Dickens, wherever you are, musimame ndo mumuone. There's a gentleman at the back. Mumemwona? That is for breakout room 1. Wale wote ambao watenda Swara, that is a gentleman you follow for any support you require. Then we have breakout room 2, Kifaru, by Dr. Abdikadir Adan. That is our chair. Dr. Abdikadir? Here he is. Mumemwona? Watu ambao watamfuata ni wenye wanaenda Kifaru. Tafadhali, this is your session chair. And finally, room 3, which is Nyati, Dr. Elizabeth Kithuka. Daktari? Session chair? Yes, at the back. Do we all see her? This is the guidance, and I stand guided. Najua tunasikia njaa, and I would like first to give us about 20 minutes. We take some tea, and then we diligently walk to our room. Sindio? Before I cue her in, there is an amazing exhibition that has been set. After the restaurant, you walk down the path straight ahead. Partners came together and put for you to be able to talk to them more, mingle with them more, ask them more, seek for partnerships, seek for funding na hizo vitu zote, si ndio? Mkitaka UNICEF wako na booth kule, ICS wako na booth kule, Moran Publishers, watu ambao wanataka literacy ya watoto, kuna vitabu kule. Kuna wengi sana. The county government of Garissa has its booth as well. We have Kidogo Early Years, we have Path, we have Aga Khan Foundation, we have Save the Children, we have very many partners. Even us, ECD Network has a table. So kindly, as you mingle, as you look for these panelists to continue talking, visit the booths, keep visiting them during breaks. So, Barbara, this is your cue to let the kitchen know we are ready for a small 20-minute tea break. And the team help us be able to support our session chairs. Ndio watu wasipotee na watu wasichelewe. Najua tutakuwa na mikutano, si ndio? So we can leave according to rows. We come back here after we have parallel session 1, which was ideally supposed to run till 10:30, and we are short on time. Then we would have parallel session 2, which was supposed to be 11:10 to 11:55. Kifaru and Swara. So what we will do is this. I will come to the breakout rooms to guide each and every one of you and chief whip you back here according to the program. So you will see me in your rooms. So let's diligently walk out pole pole. There are 2 serving portions, serving spaces. So help me be able to have the delegates stand guided on how they should stand. The middle row, you can now stand. Slowly as you go downstairs for tea, we will chief whip you back to your rooms and then we will give you further communication.